Hello students, this is Dr. Faizan Mirza. We are discussing the general and pathologic physiology, and the topics that I am covering today are general terms and general classification of diseases and what suffix and prefixes can be added to the term of the disease. So what actually those suffixes or prefixes mean. What general terms do we use? For example, etiology. Etiology generally means the cause of the disease. What do you mean by a cause of disease? For example, if a person is suffering from tonsillitis, the tonsillitis is due to that tonsillitis due to a due to bacterial infiltration of the tissue. So the etiology is the cause of the disease. So in that case, the tonsillitis etiology will be the bacterial infection in itself. The bacteria is the etiology there, because that's the cause of the disease. Pathogenesis. Pathogenesis is the mechanism causing the disease. What mechanism is there involved? That's called the pathogenesis. Pathological and clinical manifestation generally are the features of the disease, the structural and functional features. Structural changes associated with disease, the functional changes associated with the disease are its pathological and clinical manifestations. You can take an example of any disease and then you can just, for example, the structural and functional features of diabetes mellitus is that the blood glucose regulus cannot be regulated, and you can see that the people, the person suffering from diabetes mellitus, they have abnormalities in their sole. The sensations in their foot sole is not normal. Either it's too exaggerated or it's just not there. So the structural and the functional changes occur in every disease. Sequelae refers to the secondary complications that follow a certain disease or that can follow a certain condition, and obviously this leads to complications. Prognosis refers to outcome of a disease, or you can say fate of the patient, that what likely is to happen to the patient. For example, if it's a seasonal flu, then in most cases the prognosis that the person will recover in a certain span of time. Or if a person is suffering, for example, from measles, we know that measles in most cases the disease subsides in around 2 weeks. So the prognosis is just the fate of the patient, or what outcome can we expect from that patient. Epidemiology. Epidemiology refers to the incidence of a disease in a population and its global distribution. How many people are actually having the disease? So that's epidemiological state. Pathogens are the environmental cause of the disease. Idiopathic refers to disease with an unknown etiology. Remission, it refers to the feature of diseases where the disease subsides temporarily but only to relapse later. What's relapse? Relapse means that the signs and symptoms of the disease, they reappear once the remission phase subsides. Morbidity refers to the total sum of effects of a disease on a patient, and mortality on the other hand refers to the probability that the person will die because of the disease. The disease is likely to be fatal. Acute refers to a condition with a rapid onset, whereas chronic is gradual onset and is mostly long-lasting condition. Signs of a disease refers to observable features of a disease, and symptoms refer to the subjective feelings reported by that particular patient. For example, sign of a disease could be that you can see that there's a rash on the skin, or you can see that the person is actually having an injury. So that's an observable feature. But for example, if a person is saying that I'm having convulsions, or for example, I'm having nausea at this time, so that's a symptom of the disease the patient is reporting, and you have to accept what the subjective feeling the patient is reporting. Syndrome refers to collection of signs and symptoms of diseases occurring together, coexisting at the same time, and causing a single disease. Iatrogenic is a term which we use when the ill health is caused by the action or the words of a medical practitioner. This can include, for example, adverse drug reactions, or any mishandling during the surgery, or you can say any condition in which, for example, the doctor says that, oh, you have lost so much weight, you are not eating or so. So these words, so words as well as action of the medical practitioner can cause ill health in the patient. So the words and action both matter. Diseases nomenclature is also used to state what disease, what that particular word actually means. For example, prefixes and suffixes can be added to certain terms to add a certain feature to that term. For example, whenever we use a prefix are the letters which are added before a term. So ana means absence, dis means discarded, hyper would be used for excess, and hypo would be used for below normal. Meta would refer to change from one form of one state to another. For example, metaplasia, we discussed that term, how the cells just they change altogether from one type of cells to other. Suffix, on the other hand, are the terms which are added after the term. So this is where the term ends. So itis refers to inflammatory process wherever the inflammation is occurring. So tonsillitis, for example. Oma is used for tumor. Penia is used for lack or reduced, and cytosis is for increased in quantity on count. Plasia is for growth disorders. Classification of disease is following various ways. There are various ways to classify a disease, and different books and different sources classify it differently. Disease classification globally is followed by the ICD, which is International Diagnostic Criteria, which shares its volumes, and it just says how the disease can be classified and globally recognized as well. So the classification that I am sharing with you is something very general for to just keep in mind. So classification of disease include that the disease could either be congenital. Congenital could be either genetic. Genetic disease could be due to single gene abnormality or sex-linked disease, or it could be because of some chromosomal aberration. Congenital disease, other than being genetic, could be non-genetic as well. A non-genetic disease can be some kind of malformation or abnormality in the growth in the fetal life. The other category of disease is acquired. This includes inflammatory diseases, vascular diseases, growth disorders, injury, and disordered repair where the scar tissue forms, you can say, or metabolic and degenerative diseases. So this we just broadly can classify disease into congenital and acquired. Congenital refers to since birth, present since birth, normally. But there are cases of genetic disorder which are not present in birth. They take time to show or manifest themselves. For example, Huntington disease. That's it from my side. Thank you so much.